Hello everyone and welcome to Health Bites. This is the first in a series of many videos that we'll be talking mainly about health conditions, how they are caused, what causes them, symptoms and how to prevent them, and treatment methods, if any. So the first off, we are going to speak about allergies. We all know most of us have allergies of some sorts, whether we have a stuffy nose, whether we eat something and we have an allergic reaction such as rashes coming up on our hands, we have a swollen face, swollen skin, etc., etc. So let's dive into the meat of the matter. So first off, allergies. So what exactly is an allergy? Reading from healthywoman.org, it says, an allergy is a response of a person's immune system to a normally harmless substance, one that doesn't usually cause problems for most people. In an allergic person, an offending substance can trigger an immune system response, which functions as the body's defense against invading agents such as parasites to respond to a false alarm. So basically, they're saying that an allergy is basically a false response to any substance that may enter your body and trigger your immune system. Furthermore, the immune system treats the allergen as an invader by generating large amounts of a certain type of antibody, a disease-fighting protein known as LGE, that attaches to specific body tissue and blood cells. The cells are then triggered to release powerful inflammatory chemicals such as histamine, cytokines, and leukotrienes. These chemicals can act on tissues in various parts of the body, such as your respiratory system, thus causes the symptoms of an allergic response. Allergies can be more than just bothersome. Some allergens cause symptoms of asthma and rhinitis like sneezing, runny nose, stuffiness, and watery, itchy or red eyes, skin irritations like itching and hives or eczema, or gastrointestinal distress. In some people, the allergic response can lead to anaphylaxis or anaphylactic shock, a sudden and sometimes deadly drop in blood pressure. Anaphylactic shock can also potentially stop the heart or lead to complete closure of air passages, thus causing death via suffocation. So an allergy can be so bad that you might die from it, depending on the type of allergic reaction that you have. Furthermore, pollens, molds and fungi, dust or dust mites, animal proteins, medications, foods, latex, and other substances can trigger acute or chronic symptoms. Food allergies, which are most likely to cause anaphylaxis, are most commonly caused by ingestion of peanuts, nuts from trees, shellfish, fish, milk, eggs, soy, and wheat. Contact allergies are allergic reactions caused by a person's skin touching a substance. They are most often caused by nickel, rugs, fabric softeners, deodorants, cosmetics, perfumes, preservatives, dyes, foam, insulation, etc., etc. Plants such as poison oak, poison ivy, and sumac are also leading causes of contact dermatitis. There is a compound in these plants that can cause severe skin reactions in people which are sensitive to it, which is up to 85% of Americans. Allergies can have genetic component. If only one parent has allergies, a child has about a 30 to 40% chance of developing said allergies. If both parents have allergies, the odds are closer to 75%. So how does one diagnose if you have an allergy? So the most common allergic responses are upper and lower airway problems such as nasal congestion, stuffiness, sneezing, runny nose, etc., wheezing, along with itchy, watery eyes. If you suffer from allergies, you may have experienced one of these symptoms. And these symptoms are sneezing in bursts or single sneezes, congestion or stuffiness, which is basically nasal blockage, your nose being blocked up, runny nose or postnasal drip, itching of your throat and nose, including the palate and often the ear canals. So sometimes you might feel like your ear is so-called scratching you, as some people like to call it. Dark circles or shiners under the eyes caused by decreased venous blood flow due to poor drainage from persistent nasal congestion. Water eyes, itching of the eyes, dry eyes, conjunctivitis, or an inflammation of the membrane that lines the eyelids, causing rim red, swollen eyes, and sometimes crusting of the eyelids. Wheezing, coughing, a tightening of the chest from allergic asthma, or shortness of breath from exertion. Other symptoms might include itching in the mouth, the tongue, the palate, lips, throat, difficulty swallowing or breathing, a drop in your blood pressure leading to feeling faint and weak, abdominal pain, vomiting and or diarrhea, itching skin, eczema, which is more commonly in children. Now, on to treatment. It's important to remember that if you suffer from any severe allergic reaction, such as anaphylactic shock or asthma that causes shortness of breath, or difficulty breathing, or any other extreme discomfort, you should always seek medical attention immediately. In fact, if you ever had a previous severe allergic reaction, you should ask your healthcare professional about carrying an epinephrine injector device with you to treat anaphylaxis. Be sure you know how to inject yourself quickly and correctly. If you have to use it, be sure to call 911 and seek medical help immediately. Until help arrives, lie down and raise your legs above the level of your chest to increase the blood flow to your brain and heart. It goes on to say that your healthcare professional may prescribe some medications that can be used alone or in combination. These include antihistamines, which an antihistamine counters the effects of histamine that is released in response to the allergen. Antihistamines relieve sneezing and itching in the nose, eyes, and throat, may reduce nasal swelling and drainage, and are used to treat hives. To treat eye symptoms of allergic conditions such as inflammation, itching, watering, and burning, your healthcare professional may prescribe antihistamine eye drops that block histamine release. Don't use any other eye drops while using these, and be sure to remove your contact lenses to apply the eye drops directly to your eyes. If you wear contacts, you're probably safer switching to sunglasses during your treatment period. If you're a woman and you're pregnant, keep in mind that some of these antihistamines' effects on an unborn baby are untested. Similarly, their effects on breast milk or nursing infants are in some cases totally unknown. Always tell your healthcare professional if you are pregnant and discuss your situation with him or her before taking any medications. So, pregnant women, be sure to contact your health personnel so they know that you are pregnant or you are nursing. Other treatment method can be a spray or topical nasal steroids, which are anti-inflammatory drugs that reduce allergic inflammation. They decrease the number of histamine releasing cells in the nose and reduce mucus secretion and nasal swelling. Although they are generally safe when used at recommended doses, there are, in most cases, side effects, which may include sneezing after application, burning or stinging of the nose, you have a nosebleed, scabbing or crusting of nasal membrane, a perforated septum, but this is very rare, lightheadedness or headache, unpleasant or loss of taste and or smell, and soreness in your nose. Nasal Chrome is an over-the-counter nasal spray that may help to prevent allergic reactions. When used as directed, it may provide relief from allergies and has few side effects, which may include stinging or burning of the nose, a headache, a bad taste in your mouth, runny nose, or post-nasal dripping. Its main disadvantage is that it must be used 3 to 4 times daily. While tests have shown that it is unlikely to harm an unborn baby, don't use Nasal Chrome without first speaking to your health provider. It is not known if this medication passes into breast milk, so please speak to your professional first. Some over-the-counter products should not be used by people with high blood pressure, diabetes, or other medical conditions. If you have any medical conditions, be sure to consult your doctor again. Okay, treating skin reactions. The cause of eczema or atopic dermatitis is unknown. The primary treatment for skin eczema is aimed at alleviating the symptoms rather than preventing. To relieve the itchiness and your eczema, your doctor might provide initially a room temperature bath to remove crusted skin, followed by immediate application of a moisturizer, which helps conserve the skin's natural moisture. Topical steroid creams and ointments are effective in decreasing skin inflammation. These medications, which are in a class of medications called immunomodulators, help maintain normal skin texture, reducing eczema flares. However, due to possible effects on the immune system with prolonged use of these medications, specifically an increased risk of certain cancers, including skin cancer and non-Hodgkin's lymphoma, the FDA recommends that tacrolimus and pimecrolimus only be used when someone can tolerate other medications or other treatments have failed. So again, please speak to your medical practitioner. So, can allergies be prevented? Prevention is the best treatment for allergies. By identifying exactly what you're allergic to, you can avoid it if at all possible, sometimes greatly limiting your symptoms without resorting to medical treatment. Visiting an allergist is the most accurate way of determining what allergies you have and what you are allergic to. In the case of airborne allergens, it helps to use an air conditioner inside your home and car. Special air filtering devices can be added to your home's heating and cooling systems, but most of the equipment and high utility bills may make this option unaffordable. So what they're basically saying is that these devices, you can have them in your home, but the main drawback is that increased utility bills and the initial cost of the equipment. So sometimes you have to weigh your health in one hand and what you can afford in the other hand. Vacuuming can worsen your symptoms unless the vacuum is equipped with a special HEPA filter. Following are some helpful tips for avoiding your exposure to various allergens. So the first allergen we're going to talk about are pollens. Unfortunately, short of staying indoors when pollen counts are high, and even that may not help, there is no easy way to evade or avoid wind-borne pollen. The pollen grains are so small and light and produced in such high qualities and quantities that they are carried for very long distances. Clearing out and cutting down offending plants from your own yard does little good. Here are some things you can do. Avoid prolonged close contact with pollens, as well as some molds, by avoiding working outside during allergy season. Stay indoors during the time of the highest pollen counts, which are usually in the morning on warm, dry, breezy days. Keep your windows closed at night and don't open until after 10 a.m. Pollen is usually released between 2 a.m. and 10 a.m. If you have to work outside, wear a face mask designed to filter pollen and keep it from reaching your nasal passages. If you are planning to travel for a vacation, try to go away at the height of your expected local pollinating period, and choose a location where such exposure will be minimal, such as at the seashore. Vigorously brush or bathe pets coming from outside. Relocating is not usually recommended because the person who is sensitive to a particular pollen may subsequently develop allergies to new allergens after repeated exposure at your new location that you have moved to. Now we are going to talk about molds. Mold allergens too can be difficult to avoid. Here are some tips to reduce your exposure. Avoid places where they may be very high, such as shady areas outside, areas that are moist, garden post heaps, greenhouses, mills, barns, bins, or grain fields. Indoor hotspots for molds may include a damp basement, a damp closet, in your bathroom, places where fresh food is stored, in your air conditioner, your humidifier, garbage pails, mattresses, upholstered furniture, and old foam rubber pillows. Keep your lawn mowed and leaves raked, but have someone else do this for you or wear a tightly fitting dust mask to reduce your exposure. Avoid walking through tall vegetation and avoid travel in the country while crops are being harvested slash reaped. Use a humidifier to dry out the basement, but be sure to frequently remove the water collected in the machine to prevent mold growth there. Open a window or use a fan after a warm or steamy shower to allow the humidity to escape. Dust mites. Dust mites are often effectively reduced by decreasing the amount of dust in your home. You can dustproof your home, especially your bedroom, by removing wall-to-wall carpet, blinds, down-filled blankets, and feather pillows. Window shades don't trap dust. Curtains can be used if they are washed periodically in hot water. Hardwood floors with washable throw rugs are easier to remove dust from than carpets. Fabric on upholstered furniture traps dust much more than vinyl or leather covered furniture. Washable slipovers are a good alternative for your furniture. Encase your bedding in commercially available allergy-proof covers. Woven microfiber materials are more expensive and are more comfortable. Wash your linens using hot water, basically water that is hotter than 130 degrees, which kills dust mite eggs. If you do not want to set your water heater that high, you may dry linens at the highest dryer settings. Nor for animals. If you simply can't bear to find another home for your pet, you can try these suggestions. Keep your pets out of your bedroom. Have someone bathe your cat or dog weekly and brush it outdoors even more frequently. Remove carpets and soft furnishings that trap animal dander and dried proteins in dust. Use a vacuum with a HEPA filter. Use a room air cleaner with a HEPA filter. Wear a dust mask while you are cleaning your home. Now we're on to foods. Ask your health professional for the various names or different forms of foods that you should avoid. Probably like nuts, milk, soy, protein, soy, wheat, and whatever else he or she might tell you to avoid. Cheese, etc. Read food ingredient labels closely to check for the presence of your trigger food substances. They are often found in places you would not even suspect. At a restaurant, don't hesitate to ask the cook or chef about ingredients of various dishes and how they are prepared. Be especially aware of cross-contamination. If you're allergic to common medications such as penicillin, wear or carry something with this information, such as a medical alert bracelet or card. If you have had anaphylactic reactions, you should wear a medical alert bracelet or necklace identifying this history. Now, to top off this video, here are some lifestyle tips. Spot hidden food allergens. Know their hiding places. One type of allergic response, anaphylaxis, is a sudden and sometimes severe drop in your blood pressure that can sometimes stop your heart or close your air passages, causing death by suffocation. So, in essence, having an allergen or being allergic, and if you ever suffer from anaphylaxis, you can die because you can have a shortage. You can have your air passages being closed and your heart stopping, and then you suddenly die from suffocation. Avoid foods that you know you're allergic to is the first step in preventing an allergic reaction. So most people across the world, they are most commonly allergic to foods such as milk, egg, peanut, wheat, soy, fish, nuts from trees, and shellfish. On to the next lifestyle tip. Allergies from moles. Damp, shady, or dark areas of the home and garden harbor moles, a common allergen for many people. Just avoid these damp and musty places if you can. Use a dehumidifier to dry out damp basements. Open a window or use a fan after a steamy bath or shower to allow the humidity to escape the room. Don't store clothes or other frequently used possession in a damp area. Avoid moist, shady areas outdoors, greenhouses, and garden compost piles. Now to your pets. You love your pet, but you can't stop sneezing. All pets can cause allergies, except perhaps fish. Pet dander, skin flakes, saliva, and urine can cause allergic reactions in people sensitive to allergens. Another big source of discomfort for pet owners with allergies is the pollen, mold spores, and other outdoor allergens brought inside by your cat, your dog's fur, etc., etc. If you can't bear the idea of giving away your pet, try to minimize your allergens. Keep your pet out of your bedroom, which is the place where you spend your time the most. Wash your hands after handling your pet to avoid spreading the allergen. Have someone else bathe your pet and brush its fur outside several times a week. Have someone else clean the litter box and store the litter box away from forced air heating or central air conditioning vents. So basically that's all. That's a summary on allergens. What's an allergen? What can cause an allergic reaction? Ways you can minimize your contact with some of these allergic reactive stuff. So that's about it. That's about allergies. This is the first of many videos. So until the next time, if you like my content, leave a like, share the video, subscribe to my channel. Check the link in the description below. So hit that subscribe button, hit that bell notification to be alerted every time I release a video. So until the next time, adios. This is Health Bites.